Chicago children's mental and emotional health has been hit hard by the COVID-19 pandemic. That is the finding of researchers at Lurie Children's Hospital who surveyed 1,500 parents across the city about the impact of the pandemic on their children's behavior. Among the key findings, almost half of all of the parents spoke to their child's primary care provider about mental health concerns. 24% said their child had used mental or behavioral services over the past year, but 18% said they were unable to access such services for their child. Joining us now to tell us more is Dr. Matthew Davis, director at Lurie Children's Hospital's Stanley Mann Children's Research Institute. He co-authored this report. Dr. Davis, thank you for joining us. So what
are good to be with you, Brandon.
What are some of the behavior changes that parents reported in your survey?
When we asked parents about what sort of symptoms they were noticing, we had the highest proportion of parents who said their kids were having more tantrums than they'd been having prior to the pandemic. They were having sleep problems, including nightmares and trouble falling asleep. And they were also experiencing more difficulty getting along with their peers. Some kids were even having symptoms such as headaches and stomach aches. And all of these are common things we see in pediatrics when kids who don't have the language yet to describe their emotions are instead expressing those emotions through their behaviors.
Did any of the findings surprise you or confirm what you suspected as a physician?
These types of concerns that parents are raising in our report are certainly the types of reports that I've had from parents in my own clinic at the Uptown Clinic as part of Lurie Children's Network. But I think what we're learning from this report is just how common these concerns are. To have half of parents in Chicago say that they've sought primary care provider support for their children's behavioral health needs during the pandemic is quite a remarkable number. And we estimate if we apply that to 2 to 11-year-olds across the city, we're talking about new behavioral health needs for over 70,000 children.
So a ballooning, it sounds like. Your report also shows how children's activities changed during the pandemic. Not surprisingly, they are spending less time in person with their friends. They are doing less physical activity. They are sleeping more, spending more time on screens. How do these changes impact a child's emotional and mental health?
The first thing to recognize about the pandemic is what we all know from our own experience, and that is how incredibly disruptive it has been to the normal routines we had before. So the changes that you're describing are some of the most common activities that kids have every day. And that amount of change, that amount of disruption is very unsettling to most children. And although many kids, in fact, most kids have a lot of resilience in them, the amount of disruption in their lives and the lives of the adult caregivers in their lives, with parents, grandparents, aunties, and uncles, has really been tremendous. It's hard to imagine a more severe disruption than what this pandemic has caused.
What are your concerns for children who may have already had existing behavioral challenges before the pandemic? Perhaps children with autism especially. Have they been exacerbated?
Brandis, that is a particular group that we're concerned about in the pediatric community, because we know before the pandemic that we are working hard to try to support the needs of families concerned about the behavioral symptoms that their children were having, whether it be autism spectrum disorder or other concerns. Because of the disruption of the pandemic that we were just mentioning, the regular routines that are really vital to helping children with behavioral health needs cope with that those daily goals that they have along with their families have also been blocked or obstructed in some key ways. And that's been really a challenge for those kids and for their families. What that's leading to across the country, certainly here in Chicago and in many other locations as well, is a need for hospital level care for some children whose behavioral health needs have really increased during the pandemic, even though we've been trying very hard in the outpatient setting to manage them.
A struggle for those families, I'm sure. We also know that the pandemic has hit Black and brown communities the hardest. What differences did you notice for children who are of color and low-income families?
Of course, that's an essential consideration here in Chicago. And at Lurie Children's, we've been working on reaching out to communities of color with our peer institutions across the city to make certain that the coping strategies with COVID-19 are brought to the communities, not asking the communities to come and find those strategies. When we ask parents from all the 77 community areas of Chicago about the behavioral health needs of their children, what's really striking is that all parents have experienced this in a very similar way. So this is not something that, like COVID-19 itself, has disproportionately affected communities of color. This is something that's affecting all families.
You mentioned some of the behavior challenges that younger kids are exhibiting, but what about teenagers, and how might the signs of distress differ for an older group of children?
Brandis, that's a great question, and something that we see in pediatrics frequently is if teens can express those feelings, if they're comfortable doing that, they often will express how much distress they're having. But if they're not as comfortable expressing that, then what we may see instead is withdrawing from family relationships or from really well-established friendships. We may see changes in eating and sleeping behaviors, and we may see acting out, even in the older age kids, in ways that are unfamiliar to their families.
In about the 30 seconds that we've got left, Dr. Davis, what advice do you have for parents? Where can they go for help if they think they need it?
One of the reassuring parts of these findings is that we saw so many parents reaching out to their children's primary care providers. They are the first line of support. Our behavioral health specialist companions here in the city are a vital part of the teamwork as well. And parents who are in distress should know that they are not alone, and there are many resources. There's the NAMI, N-A-M-I, Chicago Helpline. There's the crisis text line. You text HOME to 741-741. Or in cases of extraordinary distress, you can reach out to the National Suicide Prevention Lifeline at 1-800-273-TALK.
Okay. Dr. Matthew Davis, thank you so much for joining us.
Thank you for having me.